Campaign Action Officer, Psychological Health Center of Excellence, Defense Health Agency. Without further delay, I will turn things over to Lieutenant Yvette Pender.
Okay, thank you, Sam. So next slide. I'm going to read the disclaimer. The appearance of hyperlinks does not constitute endorsement by the Department of Defense of this website or the information, products, or services contained therein. For other than authorized activities, such as military exchanges and morale, welfare, and recreation sites, the Department of Defense does not exercise any editorial control over the information you may find at these locations. Such links are provided consistent with the stated purpose of this Department of Defense sponsored webinar. Next slide. All right, so this is the agenda. We're going to discuss PTSD today. I'm going to talk a little bit about female and their experiences, as well as dealing with some symptoms and then myths, and then talk about treatment, and then, of course, the Real Warriors campaign. Next slide. So we're on slide 4 now. So we know that PTSD really can occur from traumatic experiences, right? But it's not necessarily combat related. It can happen anywhere. At home, certainly during deployments, trainings, and it might not be military related at all. Not everybody who has a traumatic experience will deal with PTSD, but it's estimated that around 10 to 14% of service members who have served in Iraq and or Afghanistan have developed PTSD. Next slide. So when we talk about traumatic experiences, there's sort of a range of events. It can certainly be losing a close friend. It can be bodily harm, limb loss, that kind of thing. And maybe it's just a violent experience, such as an attack on one's base. And I think what there's sort of a continuum here. Indeed, you may experience a very severe traumatic event. But we also know that there can be ongoing stress reactions from that event, or there may be ongoing traumatic events that are occurring. But in any case, it doesn't always, but there is a concern that it can lead to the development of PTSD. Next slide. Excuse me. So we know that there are various signs and symptoms. And I think that it's important to note that when folks are experiencing these signs and symptoms, they may experience one of them. Somebody else might experience two of them, flashbacks and trouble sleeping, sadness and intrusive memories. The experience may be different, but it is important to be mindful of a couple things. And one of them is, if these concerns continue for more than 1 month, maybe it's just time to step in and ask a provider for additional help. The other thing that happens is folks around you, right? Your family members, your unit members, your friends, they also notice some of these signs and symptoms as well. And they may be, sort of that trigger for you to say, hey, you know what, let me go ahead and get checked out. And the reason why I bring that up is we know that sometimes we experience these symptoms and we're not sure what they are. Or we've always been dealing with them and we've dealt with them for a pretty long time and we think we're doing okay. So, but you're able to kind of gauge that 1 month period or, sort of hearing from those around you, that may be a trigger to, get in and get that treatment or get that help. It is a sign of strength. Next slide. So, excuse me, with females in the military, there are unique stressors and integration challenges. So certainly, females will have the potential also to experience those traumatic experiences. But sort of adding to that are these possible feelings of isolation, not having necessarily other female battle buddies to talk to relate to. There are challenges in accessing specialized health care. The other piece to consider is, females in the military may, sort of overcompensate around their male counterparts, right, to sort of dispel any negative stereotypes about females that they know are sort of around. And so sort of ignoring injuries going above and beyond to prove their strength and sort of their worth to their unit or to their leaders. Next slide. Females are indeed at increased risk for PTSD, depression, and substance misuse. And so a little bit of background, just to give you an idea of sort of 15% of the U.S. military is made up of female service members. And recently, we know that sort of all jobs and so all those some military specialties are now open up to females. And so there's sort of additional considerations that we need to take into account. Okay, can we show the video, 4 facts about PTSD?
Four facts about PTSD. After a traumatic event, it's common to have reactions like upsetting memories, jumpiness, or trouble sleeping. If these reactions don't go away, it could be associated with post-traumatic stress disorder, also known as PTSD. PTSD symptoms usually occur within 3 months, but may appear 6 months or years later. PTSD is treatable, and treatment works. Being diagnosed with PTSD won't automatically affect a security clearance. Seeking care early equals a healthier life. To get connected with a provider, or if you have questions about invisible wounds, contact the DECO Outreach Center at 866-966-1020 or visit realwarriors.net/livechat. It's 24/7 and confidential.
You can continue.
Okay, thank you. So we're on slide 10 now. So we talked about those symptoms that are associated with PTSD, the flashbacks, intrusive memories, nightmares. I think it's a good idea to kind of get a handle of what might be expected if you're experiencing these symptoms. And they can occur day or night. They can occur recently, right? So sort of right after an event, a traumatic event happens, you may experience it. But it's also important to note that you may experience symptoms up to years after the event. And again, it might be a result of a combat, a training accident, a sexual trauma, or any other type of trauma. But the one thing that we really try to message and put out there is the earlier you sort of seek out even just talking about it, the better off you may be. And the self-management, even the self-management of symptoms, as I discussed earlier, a healthcare provider can help you better self-manage. It doesn't always necessarily mean that they're going to, try to put you onto some type of medication, for example. So if you're able to get in there a little bit earlier and start talking about the symptoms you're going through, you get a better understanding of what's happening, when it can occur. It might happen years later. And so that's one of the things that we talk about. Next slide, slide 11. And so we talk about the various strategies to help manage flashbacks, intrusive memories. The first one is tell yourself you're having a flashback, or acknowledge it. And the provider can help you sort of know when you're having a flashback. Remind yourself that it's over, right? So it's no longer happening at that very moment, and using your senses to help you stay present, right? Using your eyes, your nose, your ears to help you sort of stay in the present. And then knowing what makes you feel safe in that moment, what's going to make you feel safe at that moment. And then finally, the triggers. 4th of July is coming up. I've got some buddies that don't like 4th of July. It does trigger some symptoms for them. And it took them some time to realize that, because 4th of July tends to be a time for family and friends and fireworks. And so they've learned to sort of work around those issues and not engage in 4th of July, or just not engage in the fireworks and things like that. All right, the video, Coping with Flashbacks.
Coping with flashbacks between appointments. Flashbacks can decrease as you progress through treatment for PTSD. If you're between appointments, use these tips to manage flashbacks. Tell yourself that you are having a flashback. Recognize where you are and say it aloud to help feel safe and secure. Remind yourself that the traumatic event causing your flashback is over. The feelings you are experiencing are memories of the past. Use your 5 senses to remind yourself you are in the present. Look around you, listen to the sounds, walk into another area and grab a drink of water. Find what makes you feel secure. Practice relaxation exercises or call someone you can trust. Write down the triggers that led to your flashback. Flashbacks can happen day or night, soon after your traumatic experience, or even years later. It can help to write down what causes them. To get connected with a provider, or if you have questions about invisible wounds, contact the DECO Outreach Center at 866-966-1020 or visit realwarriors.net/livechat. It's 24/7 and confidential.
You can continue.
Okay, thank you. All right, so we're on slide 13, dispelling myths about PTSD. So part of what the Real Warriors campaign does, and we'll speak a little bit more about this, is a lot of face-to-face events. We meet with service members who are returning from deployment, getting ready for deployment. We meet with Reserve and National Guard. And this is over years that we've been doing some of these events. And a lot of myths have kind of come up, and there's some general themes. I mean, I wanted to sort of talk about them here. And so one of them is PTSD is always combat related. And as I discussed earlier, it can be trauma from anywhere, a traumatic experience from anywhere. The next one, service members can never recover from PTSD. We did talk about getting help early can significantly improve your symptoms. And we'll acknowledge that PTSD can reoccur, but treatment helps you better understand what you're going through, and it gives you, yourself, the tools to cope better with it, with having it and with the symptoms. The next one, service members of PTSD have all the same symptoms. So as I said earlier, some folks might have flashbacks, intrusive memories, some folks might have sadness, and so everyone experiences PTSD differently. And even if you have the same symptoms, it's each person experiences the same symptoms, even differently. Getting help for PTSD will hurt my ability to get or maintain a security clearance. That's not true. And the other thing I kind of want folks to sort of consider, not getting your symptoms of PTSD addressed, can impact your ultimate readiness, right? So it's better to just, again, seek that help early. And then only service members experience PTSD. As I stated, anyone who faces a traumatic event can develop PTSD. Next slide. Okay, so I'm going to talk a little bit, just give an overview of the common treatment options for PTSD. Part of our feedback from service members over the years have been around, even if they understand that there might be something going on, and the family member also might say, yes, there's definitely something going on, they don't know what's going to happen when they go in for their visit, right? What does that treatment look like? Is it a needle? Is it a pill? What is that? And a lot of myths run around, well, they'll just give you a pill. And I want to talk a little bit about the common treatment options. So cognitive behavioral therapy is the common treatment option that is given to service members. And then it's broken out, right? It's trauma focused, and then non-trauma focused. So I'll just speak very quickly about them. There's the prolonged exposure therapy, right? And that's actually speaking out loud about the trauma, confronting situations you've avoided because it reminds you of the trauma, and then reviewing the trauma until the memories are less painful. The cognitive processing therapy. So these are like learning skills to help change your beliefs associated with the trauma. And then understanding that how you experience that trauma has altered your thoughts and feelings. And then there's eye movement desensitization and reprocessing, excuse me. And here you're focusing on sounds and alternating eye and hand movements while thinking about that trauma you experienced to help reduce the anxiety around that memory. Included in that, you may also learn some relaxation methods. And then there's narrative exposure. You kind of just lay out the life events in chronological order, excuse me, giving attention to the important events, including the good events, and then the not so good events. And it helps you to put things in sort of perspective, right? You're focusing on all of the events, not just the ones that were less pleasurable or even traumatic to you. And so moving over to the non-trauma focused treatments, the stress inoculation, learning breathing and muscle relaxation skills in practice to kind of control your thoughts. And then there's the interpersonal therapy, which kind of looks at some of your interpersonal problems and how do we resolve some of those problems and recovery from your symptoms. The thought is that relationships and life events can impact your mood. And then finally, present-centered therapy, problem-solving strategies to manage the stressors, right? So that's sort of looking at your current behaviors that might influence the PTSD symptoms that you're experiencing. And so I wanted to just go over those. You can go to our website, realwarriors.net, to learn more about them. But again, this is just to give you an idea of the experience of symptoms, what type of treatment you can expect to see. And again, this was put out to also address some of the myths around what happens when you get treatment. All right, next slide 15. Okay, so I'm going to talk to you about the Real Warriors campaign, which is out of the Psychological Health Center of Excellence. Our two main pieces were a multimedia public awareness campaign, and we've been around since 2009. We're looking to reduce stigma around psychological health concerns and increase help-seeking behavior. Those are our two main thrusts. We focus on service members, veterans, and families, and then we also have resources for providers as well. Next slide. Since we're on slide 16 now. So we have a lot of materials and tools. The first thing I want to note is it's free psychological health resources. We ship anywhere in the world, no charge to you. We have over 160 articles, PTSD, but we also have depression, various types of dealing with sleep issues and things like that. We have video profiles, which we will show one of them a little bit later. And the video profiles tend to be very popular with service members. We started video profiles years ago. Service members said that they wanted to see themselves. They wanted actual proof that, that a tech sergeant went in to seek help and that he actually got better. They want to see that. What's the proof of that? They don't want to read about it or hear about it. And so those video profilees, they are service members that went to seek help. They're quite honest. It took some time for them to go into seeking help. It didn't work right away. It took them years, maybe in and out, but they finally did it, and they're able to reintegrate with their family, back into the mission, and so forth. We also have 24/7 Psychological Health Resource Center, which we will discuss later. You may, at this moment, even go on our realwarriors.net and you can view, download, request shipping of materials. We have a large social media community. So we are on Facebook and Twitter, and then our partnership network. So we cannot do all of our efforts without our partnerships. It's not just VA and SAMHSA. We have partnerships in states and all the various states. We have partnerships internationally, and the idea is that our partnerships actually create the network for us, right? So we might not have a lot of materials dealing with children and how to talk to your children, but we are partners with Connected Health, for example, and so they have a lot of materials on how parents can talk to their teenagers, parents can talk to their children, how children can talk to their parents about deployment. And so they're helping us link. And then, of course, we share resources. And then finally, we do things like that, participate in webinars with our partners, Military OneSource. And we attend conferences and media events and so forth. Next slide 17. So I wanted to go quickly over our goals. Educate and reduce misperception. That is a big one. That's why, we just had a discussion around the myths about PTSD. Fostering a culture of support. That is done through our social media. That's done through our partnership network. That's done through every single person that comes to our website, somebody who shares a post that we put on Facebook. Restoring faith in the military health system. This is a big one that our video profilees help to get folks thinking that the system actually does work, and it does work, it can work, and you can be successful in it. Improving the support systems. We have a lot of family resources. And then finally, empowering the behavior change. So that is around, again, that belief that you can go in and actually get help. You believe that you can stick to the treatment if whatever treatment you're given, and then there's the belief that you'll get better, that you will get better, and you will be able to go back to supporting a mission. You'll be able to reintegrate with your children, your family. Next slide. All right, so these are just a few of the resources, dispelling myths about PTSD, the treatment options, 5 ways veterans can support PTSD treatment. These are just a few of them. And our materials come in all different ways. Right? You have infographics, which are kind of like a smaller poster. We have trifolds. We have booklets, mini brochures. Again, we ship them free of charge. So not every single article comes in any way. We found that we have a sleep article and the infographic just flies off the shelf. Folks like it. It's one-stop shopping. Next slide. And then we also, like I said, we have videos. We have our social media, Twitter and Facebook, of course. I am going to talk about the 24/7 outreach resources. So next slide, slide 20. Okay, so Psychological Health Resource Center serves everybody, service members, family members, veterans, clinicians, program managers. When you call up, you are speaking to at least a master's level trained resource technician, resource consultant. They can give you information on anything psychological health related. They also can give you information on where to obtain care. So it's pretty nice. One of the things that the Psychological Resource Center offers is, information on in transition. So if you're already in care and you're transitioning to another installation and you want to transfer your care over, they can help you do that. So it's really wonderful one-stop shopping there. All right, next slide is a video profilee of Major Jeremy Haynes.
When a challenge rises up, do we let it stand in our way or go the distance to overcome it? I didn't want to stay at the bottom, but after I was shot 4 times in Afghanistan, I was told I'd never walk again or have feeling below my waist. If I even survived, I felt paralyzed, physically and mentally. There were many times where I took 2 steps forward, only to be knocked back 5. When I struggled to get up my hill, depression and thoughts of suicide threatened to keep me down forever. My wife and healthcare providers were there to catch me and push me forward. I learned that psychological care is key to recovery from both physical and invisible wounds. It's been more than 2 years and my journey is still ongoing, but I know I won't quit. Decide now that I will take the first step. Woo! Reaching out is a sign of strength. Visit realwarriors.net or call 800-874-2273.
You can continue.
Okay, next slide, slide 22. So as I said earlier, we engage in social media. We know that our military community, especially 18 to 24, 18 to 29, they're on social media. They're on Twitter, they're on Facebook. And we use Facebook and Twitter to help build that network of support. We reach more than 100,000 service members per day. And about 68% of our service members, of the campaign's social media followers, do self-identify as Army, Marine Corps, Navy, Air Force, Guard, or Reserve. Real Warriors campaign is one of the most engaging military health brands on Facebook. We have probably over 124,000 fans, and we do encourage you to go there through our social media. We do offer the resources. So when you go to our website, it might seem like, oh my gosh, there's a lot of stuff here, but if you track us on Facebook, we message very specifically, and we'll link you, for example, to a particular article. It's PTSD month, so we'll link to a PTSD article, or we might link to another article. So that's just another way to sort of engage in some of the resources that we have. Slide 23. Okay, so this is just an example of some of our posts. You'll notice on social media, we use imagery. We know that folks don't have a lot of time to read our articles, for example. And so what we'll do is we'll take an image, but we'll have a message around that, and we'll try to make it sort of a positive message. Combat stress can affect female warriors differently. Be there for your battle buddies. And then that link takes you to an article around how females are affected. And the same thing with Twitter, right? That link is going to take you to how you can find support, and that's intentional to keep it sort of short and simple, but we're able to get the message out in an effective way. Slide 24. Next slide. All right. So here are 4 ways to just share that message of strength for PTSD support. So, like I said, we have materials. They're shipped anywhere, free of charge. The video shorts and our profiles tend to be one of our more powerful pieces, especially with our 18 to 24 crowd. And part of it is around, again, they're seeing themselves. We also have leaders. We also have military leaders who did some video profiles and talked about, they're in this very high position, they're command sergeant major, but they needed to seek help, and they were able to seek help with their family. And it also shows, leadership can be affected, but they were also able to get through it. The other piece is, please connect with us, sharing the Real Warriors content and on social media. And again, we say, please go to our website. But if you just want to follow us on Facebook, that's fine too. It's a great way to get short and sweet messaging, and then you can click on a link and get to articles and our information that way as well. All right, and slide 25 is the last slide. So with that, I'm certainly open to questions. Here's all the information. Please reach out to me if you want to order materials, for any other questions you have. Thank you so much.
Okay, thank you. Let's get to some of our questions. The first question reads, how do I go about finding a female PTSD provider in the area that I live? The VA does not have the resources, nor are they aware of any female providers in 100 miles radius of where I live.
That's a good question. So I don't, we deal with mostly active duty in terms of, right, because we're DOD, and I know that the TRICARE nurse line can help you with that. The other thing I would probably say is reaching out to the Psychological Health Resource Center. They're pretty good, and if they're not able to answer your question right away, they'll find it for you. They're actually, I'm really good at that. So two ways: Psychological Health Resource Center, and I can. I'm not sure if that information is on this slide that we're on now, but I can send that to you, or have Military One Source send that to you. And then the other piece is, like I said, sometimes the TRICARE line can also help you sort of locate a provider. Thank you.
Okay, thank you. The next question reads, how do you get the nightmares to stop?
Okay, so for this particular webinar, we can't give out necessarily any clinical information, but a couple things you can do. Real Warriors Campaign has a live chat. The Psychological Health Resource Center, again, has master's level, and they are psychological health master's level trained consultants who can definitely, when you call up, they can help you with that question. On this call, unfortunately, I'm not a clinician, but on these types of webinars, we don't necessarily give out clinical advice. And I hope that helps. Again, I can give you the information for Psychological Health Resource Center. Let's see here. And I'm wondering, Stan, if we can go back to that slide. It is slide 20. And it's got the information there. It's got the phone number there, the 866-966-1020. And then it also has email, and then it has the Real Warriors live chat. So any one of those can absolutely help you.
So right now I'm showing slide 20 for those interested in the information.
Yeah.
Okay. The next question reads, I'm a disabled veteran due to Agent Orange and suffered PTSD in Vietnam in 1955. I'm 100% but suffering. I'm 80 years old and reside in a VA hospital. But there's no question. So thought there was a question, but it's not a question.
Okay.
Let's see. Any tips for managing 4th of July with PSD?
I think this goes a little bit back to when we talked about the triggers. And two things, right? We talked about the triggers, and we talked about folks experiencing PTSD differently. So you'll have to sort of look within yourself. What is the trigger for you? If it is the fireworks, right? I know from like I said, for my buddies, it's the fireworks. And so they just don't go to areas, or they leave an area where they know there are going to be fireworks. They're still with their family and friends and things like that. But that might be the best way. The other thing, and I know I keep referencing this, is the Psychological Health Resource Center may have access to, places where folks who don't like fireworks, right? Because while fireworks can be a trigger for folks, some folks also just don't like fireworks but want to be able to do an activity. And so there may locally be something that you can do that doesn't involve, if that's your trigger. And then reaching out to PHRC, there may be, they may have additional ways to kind of find either other activities for you to do or activities to avoid. And finally, locally, we're here in the DC area. Locally, they do put out, hey, this is when these activities are going to occur. This is when you can expect the fireworks to occur. And so it's sort of for you, if that's your trigger, you can simply say, you know what, I'm going to do this activity until that point, and then I'm going to stop and go somewhere so I don't have to be involved at that time. So thank you.
Okay, great. The next question reads, I'm an Air Guard spouse. My husband has battled with PSD PTSD for 5 years before getting help about 6 months ago. He's doing great, but how and where can I go as a spouse to get the support guidance to support him and myself?
Yes, thank you. So let's see here. So if you go to, I'm on the Real Warriors site. If you go to realwarriors.net and go to, and there's at the top, you'll see active duty, National Guard, veterans, families, health professionals. If you go to families, there's actually two links, right? There's a link there that says supporting your service members. And then there's another link that's taking care of yourself, right? Because as a spouse, you also need to take care of yourself as well. And so we've got resources there for both. Over.
Lieutenant Pender, were you finished with that
Yes.
answer?
Yes.
Okay.
Yes, I am.
Yeah, you had broke up a little bit, so I wasn't sure. Okay, great. Thank you. Next question. Let's see. What are the consequences associated with PTSD?
Okay. I guess we can't ask to be more specific. So, I think some things to think about with PTSD. And again, I am not a clinician, but there may be ultimately impact on readiness, right? So impacting the symptoms, impacting your ability to do your job, impacting your family, and again, we've got, have that discussion with your family helps, but they're watching that particular person go through this issue, and they may feel helpless themselves. So it has that impact on family, including children, and again, early intervention, right? So seeking that help early, even at the first sign of symptoms, if you're not sure what it is, that early piece of reaching out to that provider, that family member, just getting comfortable talking about it helps a lot, right? It helps a lot to reduce those symptoms. And it also helps you kind of get more comfortable in speaking about what's going on with you. So I hope that helps a little bit with that. The other piece that you can do is on the Real Warriors site, we have a much more in-depth discussion around the effects of PTSD, but those are the big chunks around your job, readiness, your family.
Okay, thank you. Next question reads, how do I get help for someone who doesn't recognize or accept his or her symptoms, maybe PTSD?
Yeah, that is so. That is a wonderful question, and I thank you for asking that. Because while we've got Real Warriors site and we have these webinars, for example, that we do, the individual just may not recognize what's going on, or they may not think it rises to that level. I think part of it is the early piece of just getting to talk about it. So ultimately, we would like folks to talk with a provider, but in order to get them to talk with the provider, they have to just be comfortable talking with anybody about it, right? Even if it's their wife or their friends or the chaplain, So having the early discussion with somebody about it may help to get that person feeling comfortable just discussing it. And outside of that, again, we can't administer any type of any specific advice to that specific problem, but I hope that helps somewhat to address it.
Okay, thank you. How do you know if it's PTSD or normal post-deployment readjustments?
The best way to know is to see your provider. They would be that individual be the best person in the best position to advise and to be able to tell you, hey, this is looking like PTSD. This is looking, like some post-deployment stress, but it may resolve. And certainly, you can expect to absolutely have stress symptoms post-combat, right? Or post a traumatic experience, right? We all know that you will have stress symptoms. And to seeing the provider early, even when you first have those stress symptoms, helps to get it clear for you to understand what you're experiencing and get it clear of, hey, yeah, this looks like this is PTSD, or you know what, these are stress symptoms. But either way, they can help you cope better and manage it better.
Okay, thank you. Next question reads, if I'm active duty and get a PTSD diagnosis, can I still deploy?
So the answer to that is, if you have a diagnosis of PTSD, your provider is the best person to answer that type of question. We talked earlier about everyone experiences PTSD differently. I might have a diagnosis and my buddy might have a diagnosis, but what does that look like for us? And the provider who is treating us is the person who actually knows the best to be able to determine, where you are, how you're doing in your treatment, and so forth.
Okay. Next question. Does PTSD impact veterans' performance in the workplace after they leave service? Did you hear the question?
I'm sorry about that. I didn't realize my phone had muted. Sorry about that. It depends on the veteran. It depends on the veteran and what they're experiencing. We do know that certainly it has the potential to do that. If the person indeed has a diagnosis, has the potential to do that. But you can think about if you have a diagnosis and you're in treatment, right? And the treatment's actually doing what it's supposed to do, and you're actually feeling better, then maybe actually the veteran is fine in the workplace. You know what I mean? So I don't know. It's like a very specific instance, but I think the point is that having a PTSD diagnosis isn't, gloom and doom and bad. Seeking that treatment will help, and seeking the treatment early will help a lot as well.
Okay. Next question. Do other mental illnesses make PTSD worse?
So there can be co-occurring, right? So you can have sort of co-occurring pieces along with PTSD, other mental disorders. But in terms of making it worse, it just depends on the person and how they're experiencing it. So that individual may indeed feel like their PTSD is worse, but they also are experiencing, another mental health disorder as well along with it. So it kind of depends.
Okay. This is not a question. It's more of a statement to the participants who are asking questions. Each of the participants that ask questions may want to also check with their insurance providers, as they may have a care manager that can help them navigate resources and connect with providers. That was just a general statement for those who are
great. Thank you for that.
On the webinar.
Yep. Thank you for that.
Okay. Let's see. I think we have a couple more questions. What can you do to diffuse a PTSD event? When my husband loses it, he usually breaks something. what can you do if they grab you by the neck or pushes you up against the wall? I feel that if you fight back, it will only get worse. Other times, it is saying very hurtful things. It is very discouraging and makes me want to walk away. So I guess the question is, what can you do to diffuse a PTSD event?
Okay, so for that individual who's experiencing that, I'm definitely sorry to hear that, and I will say, Psychological Health Resource Center is 24/7, and so again, that number is up there. When you call them, they have a lot of resources, and then they can actually link you to providers and things like that. And they're very good at sort of crafting out kind of what you need immediately and what resources you need and things like that. So I really encourage that listener to please reach out to the Psychological Health Resource Center.
Okay, thank you. Let's see, trying to weed through comments and questions. Do people with PTSD pose an increased risk of violence to themselves or others?
I am not terribly familiar with the literature on that. It is thought that there's a lot of myths around those with PTSD are violent, and I'm not familiar with the literature. I don't believe that is actually true or correct. And again, everybody experiences PTSD in a different way. But there are a couple of, you can actually kind of, there are a couple of ways you could probably look it up via, the literature and so forth. But I'm not terribly familiar with the statistics or and things on that.
Okay. It looks like we are done with the Q&A session. So if there was anything you would like to say in closing, this would be a good time.
Oh, okay, sure. Thank you again. Really glad I was able to participate in this. And I really encourage folks, if you don't remember anything else, the Psychological Health Resource Center and realwarriors.net. RealWarriors.net has a live chat, and you'll be chatting with folks at the Psychological Health Resource Center. So, please reach out to any of those for additional resources. If you're just interested in our resources, we do ship anywhere, like I said, anywhere in the world, free of charge. So again, thank you so much.
Lieutenant Pender, we do have one more question that just came in. I just want to read that one. The question reads, can you get administrative, separated, or medically discharged due to being diagnosed with PTSD?
So that would, again, have to do with, it's on the case, it depends on the case, right? I think that's sort of a part of those myths, though, that kind of go around. Having a diagnosis alone is not the reason. Is not a singular reason that folks get a discharge or administrative leave and things like that. Actually, there's a lot more to it. Same thing on a related note: security clearance issues. It's not because you said, I did go to see somebody for my psych health issue. There's a lot of other moving parts with it. And so if that comes up, there's sort of the totality of the case that's taken into account and not just the one fact that you may have a diagnosis of PTSD.
Okay, well, thank you. I would like to thank you, Lieutenant Pender, for sharing your invaluable experience and expertise. I would also like to thank our attendees for participating in today's webinar. And if you find yourself having questions after the webinar is over, as Lieutenant Pender mentioned during her presentation, you can find a lot of the questions and different resources at www.realwarriors.net. This concludes today's webinar on PTSD care and support, Real Warriors campaign resources. Thank you all for attending and have a great day.